Hi, I'm Greg Fell, I'm Director of Public Health. This is a situation report on epidemiology for today, 28th of June. Are definitely above 1, has been for a couple of weeks now. Case rate for the population as a whole is approaching 100 per 100,000, and that's going to go upwards. At the low end of where we are across the rest of Yorkshire, and that won't have happened by magic, so thank you to all of those who do keep following the rules. Quick growth, actually. Certainly not exponential growth, but quick growth. Most of the growth is the Delta variant, which is almost all of the COVID that's around at the moment. It's more transmissible, but ultimately Delta is COVID, COVID is Delta, and the things that we need to do to keep growth down are all the same. Most of the growth is in the under 30s, definitely in the under 35s, who are the least well vaccinated of our population to date, and I should come back onto that. Slight uptick in hospitalisation, only slight, and interestingly, looking at hospitalisation data over time, we're getting to a much younger cohort of people in hospital, much lower number of people in hospital, but looking at the cohort, it's younger, they are unvaccinated. This virus still can harm people, and there's an appreciable number of under 40s who've been harmed by the virus over the course of the last couple of months. There are some double vaccinated people who will end up being hospitalised. Remember, the vaccination isn't 100% effective, it's about 85% effective, and it only works if you've been vaccinated. And there are still some people in cohorts 1 to 9 that haven't yet been even partially, never mind fully vaccinated. So there are still some risks out there, and it's important that we do get vaccinated. Being double vaccinated doesn't reduce your risk to 0. It reduces the risk of hospitalisation for an 80-year-old to about the same as a 50-year-old. So it reduces but doesn't remove the risk. So we still do need to take some care. So long COVID is a concern, and the more the virus spreads, the more long COVID there will be, and that does concern me a lot actually. For whatever variant of the virus happens to be around at the moment, the messages are exactly the same: hands, face, space, air, open windows, let air circulate, and vaccinate. If you have symptoms, stay at home, and if you're doing asymptomatic testing to enable you to go outside and reduce risk, then keep doing that, because that will make a bit of a difference. But all of those things together are reducing our risk and keeping our rates low, but they are going up. They're going up everywhere. There is still the potential for harm. Our rates in Sheffield are lower than elsewhere in Yorkshire, but going up reasonably quickly. But we want to keep our rates as low as possible. We want to keep Sheffield open. So for all of the stuff that's coming up over the summer, the best way to do that is to keep following the safety rules and to get double vaccinated. So the grab a jab campaign means any adult will be able to get COVID vaccine without an appointment. There are pop-up, walk-in vaccination centres across the city, most notably the Octagon at the University and Darnall Primary Care Centre, where you can walk in without an appointment, and that's available to anyone over the age of 18. And more details will appear at the end of the video. In terms of the rollout, it's been a success. Many tens of thousands of over 18-year-olds have now had their first dose, and obviously will continue to see that they get the second dose. It's a great opportunity to, one, get vaccinated and protect ourselves and others, and keeps our city open and gets us back to normal as soon as we possibly can. I am hearing that there's a worrying number of people not taking up the offer of the second vaccination when contacted. The first vaccination gives you some protection, but not the full protection that you get from both vaccinations. It's really important that you get fully vaccinated, i.e. take your second dose when offered. This seems to be particularly the case against the Delta variant, and it's really important that you get fully vaccinated as soon as possible. So please take up the offer to get vaccinated as soon as you're contacted, because we want to get as many adults fully vaccinated as possible as quickly as we possibly can.